This new breakthrough in cancer treatment is already saving lives. Cancer is potentially fatal for 1/4 of the population. 1 in every 4. That means 1/4 of everyone that I already saw today could possibly die from cancer. 1 in every 4.
Mariah, you ready for the interview?
Thank you so much for meeting with me today, Dr. Simcik. So I've been reading that Dr. Allison created and discovered this new treatment in cancer, and it's called immunotherapy, and it's a new version of immunotherapy. So tell me how this is different than the immunotherapy that I've heard of before.
The new discovery that Dr. Allison has made is a chemical way of covering the break so that the immune system is free to respond to the tumor. So instead of trying to activate the immune system, the new thinking is the immune system is fully active anyway, we must remove the brakes.
Okay, so he technically discovered this break?
It was his idea, it was his original discovery.
So my understanding is that Dr. Allison discovered this new treatment, and Dr. Sharma is the one actually initiating and basically creating the clinical trials for this.
She is. And that's what happens in research. You can do the research to discover the drugs, but you have to, at some point, deliver the drugs to the patients. And Dr. Sharma is in charge of delivering the medication, being sure that the patients are safe, and actually treating the patients with this new type of treatment.
To utilize this treatment, what does that consist of?
They would give a round of 4 injections of this new medication. These 4 injections of this medication would be given over a period of about 6 weeks or 2 months, and at that point it's over, and if the patient responds, they're cured and the cancer's gone.
Wow, so 4 shots.
4 shots.
And the side effects are much more mild than radiation and chemotherapy.
There are side effects because it is having an effect on the body, but the side effects are very mild and they are very short-lived.
For someone to find out more about this, they could come to the seminar that is on December 3rd at Lasker-Tomball. Coming to this seminar is not just for, recommended for people that already have cancer. It's for people even my age. I don't have cancer, but I may down the road, who knows, or I might have a friend or a family member, and coming to this event, I would be able to tell them or know myself about this treatment.
Yes. I think that's something a lot of people miss, is just because they don't have cancer today, it doesn't mean that they're not going to have cancer tomorrow. And so if you don't know about the available treatments, then you don't know what to ask your physician or the physician that discovers the cancer that you have. 1 in 4 are probably going, if 400 people attend the seminar, chances are 100 of them are going to be dying of cancer during their lifetime.
And if they attend the seminar, then they know about this treatment, and then they could potentially be cured because of this. And you said something earlier that if you don't know about it, it could be lethal.
Yeah, it's a really important point. Most people are hardwired to not really address dangers until they're immediate. And so if you don't have an immediate threat of cancer, then you probably will feel that this seminar is not really important for you. But not having cancer today is no guarantee that you won't discover tomorrow that you do have it. And not knowing about the treatment could result in you not knowing that there is a way to survive that cancer. And sometimes just taking that moment to attend the seminar, bring a loved one, bring a neighbor who has cancer, inform someone about the seminar, is the difference between life and death.
Well, thank you so much for your time.
I appreciate it. I enjoyed talking.
I really enjoyed talking to
Mariah.
you, and this is an amazing discovery.
It is.